Welcome to this fifth installment of the FARO special on psychotropic drugs, emotional suffering, and chronic illness. Today we explore one of the most innovative and deeply human aspects of the FARO integral method, the integration of nursing, mental health, spirituality, awareness, and humanized care. One of the great contemporary crises is not only pharmacological. It is also a crisis of humanity in healthcare. Clinical barbarity begins when human suffering no longer moves us. Many patients feel reduced to protocols, fragmented into diagnoses, or treated only through symptoms. This is especially visible in mental health and addiction, where people often arrive emotionally exhausted, vulnerable, and isolated. FARO proposes recovering a fundamental idea. Care can also become an experience of dignity, awareness, and human transformation. Where humanity disappears, suffering often becomes chronic. FARO and integrative nursing. The FARO integrative method does not replace scientific nursing. It expands it clinically and humanistically. It integrates science, emotional regulation, spirituality, clinical listening, complexity, and existential understanding of suffering. Nursing no longer observes only symptoms, protocols, or medication. It also observes history, identity, relationships, meaning, consciousness, and human dignity. Caring is not only intervening on a body. It is accompanying a human being through vulnerability, blame, and human rights. People living with mental suffering, dependency, or disability often face not only symptoms but also stigma, blame, institutional abandonment, dehumanizing bureaucracy, and violations of dignity. Patients are frequently told they do not try hard enough, or do not want to recover. Many are forced to resolve alone situations that should belong to a dignified healthcare system, such as obtaining assistive devices, treatments, medication, or disability resources without adequate professional guidance. At FARO Integral, suffering is never viewed in isolation. Dehumanized social systems also produce suffering. FARO therefore incorporates an ethical, humanistic, and interdisciplinary perspective focused on human dignity and rights. FARO quote, "Not every wound comes from the body. Some are born from the way society treats those who suffer." Nanda, FARO nursing diagnoses. Spiritual distress, loss of meaning, purpose, connection, hope, or inner coherence. Ineffective coping, difficulty regulating stress, emotions, dependency, compulsive behaviors, or overmedication. NIC, FARO nursing interventions. Spiritual support, therapeutic presence, human listening, emotional containment, hope, and reconnection with meaning. Self-esteem enhancement, authenticity, emotional autonomy, recognition of inner resources, and rebuilding personal identity. NOC, expected outcomes, spiritual well-being, greater purpose, hope, coherence, and reduced existential emptiness. Active coping, improved emotional regulation, fewer compulsive behaviors, healthier resources, and greater autonomy. Interdisciplinary coordination. FARO works through genuine integration. Psychology contributes psychotherapy, trauma support, emotional regulation, and clinical intervention. Social work explores family systems, social vulnerability, exclusion, violence, precariousness, and support networks. Often, it is not only the individual who suffers. The environment is also wounded. Caring with awareness means remembering that behind every symptom there is a human being trying not to collapse. TCM and FARO integrative nursing. FARO integrates traditional Chinese medicine as a complementary approach to global well-being. Depending on legal frameworks and professional competencies, support may include diet therapy, herbal medicine, therapeutic breathing, sleep regulation, emotional balance, energy exercises, auriculotherapy, and acupuncture within authorized integrative models. The goal is not to replace scientific medicine, but to expand the tools of humanized care. Ken Wilber and the FARO Life Plan. Inspired by Ken Wilber and the AQEL model, FARO understands health as multidimensional. The FARO Care Plan considers body, emotions, relationships, habits, spirituality, culture, environment, consciousness, and life purpose. The question is no longer only what illness does this person have, but also how are they living? FARO Humanization. Humanizing does not mean abandoning science. It means remembering that science was created to relieve suffering. FARO proposes healthcare where knowledge does not destroy sensitivity, technique does not eliminate empathy, and professionals preserve their human presence. Genuine listening can sometimes relieve more suffering than interventions performed without humanity. Prevention. The best strategy against chronic suffering does not always begin with medication. It often begins much earlier. In childhood, relationships, emotional expression, meaning in life, and communities capable of supporting pain without abandoning the individual. FARO learning. Mental health cannot be built only with medication and protocols. It also needs dignity, listening, purpose, community, and human connection. FARO quote: "The future of healthcare will not only need more technology, it will also need more humanity." Subscribe to the channel, leave a like, and support my work. My kitten needs to eat. If you are a healthcare professional, comment and tell me if you would like FARO training. Study with ESSI, Integral FARO method, fully online and at your own pace. Learn science with awareness. Because in healthcare, knowledge is never neutral. It is vital.